I'm going to answer some questions from the audience of this series, which is the color and emotion application in art therapy. Let's see, the first question is, different cultures have different understanding of color. So how can therapists avoid misunderstandings caused by cultural difference when conducting art therapy? Well, that's a good question. Cultural difference to affect people's understanding of colors and emotion responses. So, when performing therapy, the therapist should establish a good communication relationship with the patients and also asking and understanding their personal and cultural perception of color by allowing patients to actively choose colors and encouraging them to explain why they prefer them. The cultural misunderstandings can be avoided during treatment, so the therapist can also better grasp the influence of cultural difference on color psychology through further cultural learning and case accumulations. Okay, let's see the next question. Are there any specific colors recommended in art therapy? For example, some colors are more suitable for relieving stress or anxiety. There are indeed some colors that have been shown to have positive effects on mood. Like blue and green are often used to relieve stress and anxiety because they are more calming, and yellow is often used to boost mood as it brings feelings of joy and optimism. But however, it is important to note that each person's response to colors is unique, so it is best to let the patients choose and explore the effects of color in combination with their emotional states. Yep. Let's see the next question. If a patient repeatedly uses dark tones in his work, does it mean that there is something wrong with their mood? How should the therapist deal with this situation? So for this question, I would like to say it is true that a patient's prefer for dark tones may reflect negative emotions in the heart, such as depression or anxiety, but emotional problems should not be judged by color alone. The art therapist should be will conduct a comprehensive assessment based on the patient's verbal expression and emotional expression in the creative process and the overall atmosphere of the work. If there are too many dark tones, the therapist can gently guide the patients to experiment with more colors and encouraging them to try to express different emotions in order to explore and change their inner emotion states. Yep. Okay, the next question. If patients take the initiative to use a variety of bright colors, does it necessarily mean that they are emotionally positive? I don't think so. The use of the bright color may indicate a willingness to express oneself and experiment positive emotions, but it may also be a way for the person to hide anxiety or other complex emotions. Like, for example, some people may mask sadness or upset with bright colors, and the therapist needs to communicate with the patients to further understand the emotional states behind it. The use of bright color is only a superficial signal of emotions, and the final interpretation must be combined with the entire treatment process and the patient's personal feedback. Yep. And the next question is color selection completely unconscious process, is it possible to let the patients actively choose a specific color through guidance? Well, the color choice are not completely unconscious. It may reflect the patient's current emotional state and underlying psychological needs, but the therapist can indeed guide the patients to actively choose some specific color. For example, if a person is feeling down, the therapist may encourage them to experiment with warm colors to stimulate emotional vitality. Yeah. Well, the guidance should be gentle and non-mandatory. So that can ultimately respecting the patient's personal preference and choices. And actively chosen colors tend to be more reflective of their inner emotions and are more I think it's like more helpful to the therapeutic effect. Okay, let's move to the next question. In art therapy, are there any specific suggestions for color combinations? Like which color matching is more conducive to the therapeutic effect? Well, it's a good question. Color combination can really affect mood. In art therapy, the combination of warm and cool colors is often used to balance emotions. Like the blue and orange can bring a balance of tranquility and vitality, which is suitable for patients with high mood swings. And the green and yellow combination can provide a sense of vitality and is suitable for those who are feeling down. However, the effect of the combination varies from person to person, and the most important thing is to encourage patients to experiment with various colors combination to find a way to express their emotions that works for them. Yeah. The next one is okay. How many? Okay. Have any studies shown that a certain color may cause similar emotional reactions in different groups of people? What does this mean for the art therapy? Well, it is true that studies have shown that certain colors elicit similar emotional responses across different culture and people. Like for instance, blue is often associated with calm and relaxation, and red tends to trigger excitement or alarmness. These common responses have some values for art therapy, but therapists still need to be flexible in choosing colors based on the individual's unique experience and background. The universality can provide direction for treatment, but individual differences are at the core. Okay, let's move to the next one. In the process of art therapy, if the patient does not like a certain color, does it represent any psychological states? How should the therapist deal with it? a person's aversion to a certain color may be related to their mood, memory, or personal experience. Like, for instance, some patients may resist the color red because it reminds them to anger or anxiety. So, for that moment, therapists can use this color preference to gain insights into the patient's emotional state, but should avoid forcing the patients to use colors they don't like. Instead, try to guide the patients to understand why they have a strong reaction to a certain color and explore whether they can gradually adapt to it through small steps. The next question is, will the experience of colorblind patients in art therapy be affected? How should therapists adjust the treatment method? Well, people with the color blindness do have limitation in color recognition, which can affect their emotional expression and creative experiment. In these cases, the therapist can focus on elements such as the shade of the tone, the shape, and texture rather than relying solely on the colors itself. By encouraging patients to pay attention to different brightness or combinations of colors and to use other artistic techniques, therapists can provide more ways to express themselves and ensure that the experience of people with color blindness is not limited. Okay, let's move to the next question. In new technologies such as virtual reality, does color have a similar emotional impact? Are these techniques suitable for art therapy? Yes, it is. Color can also elicit emotional responses in new technologies such as the virtual reality, which is VR. So VR can be a new way of art therapy. We have talked a lot about with the VR because the VR allows patients to experience different color environments in an immersive way, which may be especially effective for patients who have difficulty expressing emotions through painting or traditional media. But however, the therapist needs to be aware of the possible side effects of VR, such as the dizziness or discomfort, and adjust the intensity and content of the treatment according to the patient's acceptance. And that's all for today. Thank you for watching. In the next chapter, the next video, I will bring you more about the art therapy thing.